Good morning, everyone. I'm Muriel Bowser. I'm Mayor of Washington, D.C., and I'm joined by members of my administration to provide an update on the district's response to COVID, as well as our recovery efforts. I want to show our recent metrics. Again, we post these metrics each day on coronavirus.dc.gov. That helps us to track the district's experience with COVID in four major groups. Firstly, the level of community spread, which we notice we have one metric in the red, but improving. Health system capacity, again, one metric in the red, also improving. Public health system capacity, all green, and community engagement, where we continue to focus on making sure we get people who have tested positive interviewed by our contact trace force. I also want to show our progress in getting DC residents and DC workers vaccinated. And I just want to pause there. Our vaccination strategy, just to remind everyone, focuses, like our testing strategy did, on everyone who lives in DC and works in DC. So when we've delivered doses, it's both to our residents and to our workers. To date, we've received over 94,000 doses. Our system is tracking that 67,000 doses have been delivered, though we continue to update the actual administrations of doses. And an additional 11,475 doses will be delivered to the district this week. Yesterday, we also made several announcements around vaccines, one of them being that moving forward on Mondays at noon and at 7 p.m., vaccination appointments will be made available for child care workers, independent school staff, and charter school staff. These appointments are available for those who work in person at a school or child care center in Washington, D.C., and the appointments are being made through our partner, One Medical. All eligible employees can register using the information they receive from the Office of the State Superintendent for Education. We also announced a pilot initiative with the Pennsylvania Avenue Baptist Church. This is a pilot for us to work with a district faith-based partner in delivering vaccine. The church will host 2 vaccination clinics for pre-registered residents. DC Health is also in a partnership to spread the word about the vaccine program. So the COVID-19 Clinician Champion Program is a partnership between DC Health and the Medical Society of the District of Columbia to provide a cadre of medical experts who can serve as speakers during community meetings and events, focus on COVID-19 and the importance and the science behind the vaccine. So each physician has a different area of expertise and can address a number of topics related to COVID-19. So requests for speakers can be made through our website at coronavirus.dc.gov/vaccine. We also have some announcements around unemployment benefits in the system. And the systems the Department of Employment Services uses to get payments to workers. For those updates, I'm going to turn to our director, Unique Morris-Hughes, to say more about what her team is working on to get relief to DC workers.
Thank you, Mayor Bowser. Good morning, everybody. I'd like to provide updates on the unemployment insurance program that impact both program operations and additional investments for the UI program. Many of you all know that on December 27th of 2020, the Continued Assistance Act was signed into law. This extended 3 programs, and it also created a brand new program. The extensions include the Federal Pandemic Unemployment Compensation Program, FPUC, the Pandemic Unemployment Assistance Program, PUA, the Pandemic Emergency Unemployment Compensation Program, PEUC, and a brand new program, which I'm pleased to announce, is the Mixed Earners Unemployment Compensation Program. Each of these programs authorized by Congress were designed to provide economic relief to impacted District of Columbia unemployed individuals. We're making comprehensive system updates. The three programs, which I'll just briefly describe, and the updates that we're making. The first for FPUC, which is the additional $300 plus-up payment, which was authorized for the week ending January 2nd, 2021 until March 13th, 2021. We have currently made these system updates and begin to deploy payments. The next, PUA, which is the Pandemic Unemployment Assistance Program for independent contractors, gig workers, or those earning income and receiving 1099s, has been authorized till March 13th, 2021, which now authorizes PUA for a total of 50 weeks. We are currently making system updates as we speak. The next program, PEUC, extends UI benefits for 24 total weeks for traditional UI claimants. This means that if you are receiving the traditional unemployment insurance payment that we have now implemented is up to 63 weeks. The next one is the Mixed Earners Unemployment Compensation Program, which is that an individual has to earn at least $5,000 in part-time income as an independent contractor, gig worker, or 1099. We will deploy this new program on February 19th. Next, I'd like to talk about some substantial investments that are being made to enhance and improve the unemployment insurance program. I'm very pleased to announce that we will be adding and introducing new technology and tools for efficiency. Using AI, we are adding a chat feature on the website which will allow for immediate answers. That means that our UI claimants will be able to interact with claims examiners and call center staff in real time. Next is increasing how we communicate. Not only will we be deploying robocalls and text messages, we will now be able to send out updates to the system or a person's claim through these channels. And then last, we are providing comprehensive staff training to improve the quality of our interactions, which we will have a modified contract call center operations on both the 17th and 26th of February. Additionally, we anticipating adding up to almost 200 staff to support the UI program. What this means is that we will have additional adjudication examiners, and we will add additional capacity in our customer navigation center, which many of you all know as the call center. I want to personally thank Mayor Bowser, City Administrator Donahue, and Director Reed for supporting the UI call center and making such substantial investments. We look forward to serving district workers and district residents. Thank you, Mayor.
Thank you, Unique, for that update, and that is indeed good news. We know that thousands of people have experienced just devastating loss because of the pandemic. You also will remember, I want to move on to talk about rental assistance and utility assistance, and I want to let a lot of people know that there's help out there for you, and you need to begin to engage it. In November, we announced the Housing Stabilization Grants, which provide financial support for renters and thus protect the district's portfolio of affordable housing. We have an update to that program since launching at the end of November. We have provided $11.5 million to approximately 4,500 households. These funds were used to pay back rent, and about 60% of the funds went to residents of Wards 7 and 8. These funds are in addition to DHCD's tenant-based rental assistance program. Through that program, we have provided $1.5 million to approximately 450 low-income households. And when we announced the housing stabilization grants, I also announced that in the new year we would adjust our COVID-19 housing assistance grant program to allow housing providers to apply for assistance on behalf of their tenants. So again, we want to spread the word about these programs. Housing providers may apply to CHAP on behalf of their eligible tenants. And while our Department of Human Services continues to process a high volume of applications for the Emergency Rental Assistance Program, or ERAP, we still have funding and capacity available in the CHAP program. So make sure if you need it or your tenants need it, you are checking out the CHAP program to apply for these funds. Polly, if you want to say a little bit more about the program and eligibility, that would be helpful.
Thank you. Thank you, Madam Mayor. Yes, the CHAP program has specific requirements for income and limits, and those are listed on the coronavirus.dc.gov/rent website. There isn't a limit on the monthly income, but the funds are there. They're there to help with rent arrears and to help you catch up and get whole with your landlord. And if you're the housing provider, you can apply now on behalf of your tenant, and we will work with the tenant to receive the funding. So applications have been increasing. We encourage you to apply. Thank you.
Thank you, Polly. So let me also say something about rental assistance. And these relief programs we're highlighting and we continue to highlight because there are currently moratoriums on eviction and utility shut-off. That doesn't mean that if you can pay that you should pay. It also means that if you can't pay, you should be seeking eligible assistance for which you are eligible, and there's considerable amount of assistance available, for both rental assistance and utility assistance. So let me say a word about utility assistance. Multiple programs are available. You can start with the Department of Energy. In the environment, it will assist income-eligible residents with heating and cooling through the Low-Income Energy Assistance Program, or LIHEAP. Eligible households can receive assistance between $250 and $1,800. Additionally, the Public Service Commission of the District of Columbia requires Pepco, Washington Gas, and Verizon to offer utility discount programs to residential customers. So please make sure you're going to find out about that at coronavirus.dc.gov/utility help. And coronavirus.dc.gov/rent. So that's our update for today. And with that, we'll take questions. Yes, sir, Michael.
Some questions for Director Unique Morris-Hughes. Is there an update on the district's $1,200 stimulus payment for PUA recipients? It was supposed to go to 20,000 people. Do we know how many people have received it? Are you still doling those out?
Sure, I'd be happy to provide an update. When I came before to provide an update on the stimulus payment, I estimated that there could be up to 20,000 people who are eligible to receive the payment. The final numbers have come in. We're just under 10,000 people who've actually received the benefit, and we've concluded the program and not paying any additional benefits.
Okay, is that just there was an overestimate of how many people will be eligible?
Well, no, I said up to 20,000 people who are eligible to receive the payment. So my estimate was correct. But once we opened up the program for everyone, we had just under 10,000 people who actually certified for the program. Just like the coronavirus, unemployment insurance is fluid. And it's novel, and so numbers go up and down. There are some people that we found that actually did not qualify for the weeks in which the program was open, therefore making them ineligible.
Okay, got it. And then could you clarify the difference between PUA eligibility and then the new benefit, the MEUC eligibility?
Sure. So the Mixed Earners Unemployment Compensation Program is actually geared towards individuals who work part-time. They have to have at least $5,000 of income and are considered a gig worker. So if you think about an individual that may have a regular 9-to-5 job, but maybe on the weekends they may have worked at a restaurant or at a theater, this program is geared towards them.
Thank you. And then for Dr. Nesbitt, I was just taking a look at some of the latest coronavirus metrics, and Mayor Bowser alluded to this at the beginning, that we're seeing some trends in the right direction in terms of percentage of hospitalizations and then also the daily case rate. And I was hoping to just get a clear-eyed assessment from you on what we're seeing in terms of these metrics trending downwards and what your interpretation of the data is.
So as you know, we always monitor our data on a daily basis, but we observe trends over time. Our daily case rate that we look at is a 7-day average. We had some inclement weather last week where we didn't have testing for a few days. And so we want to be mindful of how that impacts our 7-day average as well. Overall, we've seen trends moving in the right direction. We're optimistic that we can continue to see that as long as we have individuals in our community continue to observe the social distancing measures that we've asked people to do, wearing masks, washing their hands, keeping their distance, and being mindful of the activities that they participate in as we roll out a comprehensive vaccination effort or program. It's going to be critically important that people don't become relaxed just because they've been vaccinated in the district or neighboring jurisdictions as healthcare workers, essential workers, or individuals over the age of 65. But we want to continue to see a decreasing level of stress on our public health and healthcare systems over the next several weeks to be able to continue to move forward in our sort of getting back to normal activity.
Yes? Good morning.
It looks like DC council members started getting vaccinated last week. I'm wondering if either Mayor Bowser or Dr. Nesbitt can explain when that decision was made and how the process goes for them.
They are part of the continuity of government operations, so I think that was before the 25th of January.
So they started to become eligible, like I guess in late January when you got the vaccine.
Yes.
Back then. Okay.
Yes.
And is that allotment within that continuity of government coming from the district's weekly allotment, or is that a different stash of
I
vaccine?
think it's part of what goes to Kaiser for our first responders.
And do you know how many people have been vaccinated within that continuity of government definition?
We have a group of, I know, of about 50. And I think the council members are above that, so it's 13 of them. Okay. And not all of them are, they were vaccinated. They're in multiple groups.
Okay. What do you mean? I'm sorry, what do you mean
Some
by
of
that?
them are over 65, so they were vaccinated before that.
Got it. And then for Dr. Nesbitt, this is from my colleague Amanda. You said at the end of January that DC Health was not thinking about vaccine pop-up clinics or setting up sites in places of worship, but that has changed. I'm just wondering how your thinking around that has changed.
Sure. So for the context of that previous comment, if you'll recall, we were very clear that there are limitations on the storage and handling requirements of the vaccine, as well as high throughput clinics, the mass vaccination clinics and large venues because of the limited amount of doses that we receive. So I want to make sure we're clear on the context of that. In recent weeks, because of our need to reach certain populations from our equity perspective, we've been exploring other ways that we may be able to reach those populations, especially in wards 5, 7, and 8. You'll recall that we, last week or 2 weeks ago, spoke to you all about our partnership with the DC Housing Authority for our on-site vaccination program with some of the senior residential communities where they have age-restricted apartment buildings where the number of individuals who are in those buildings is high enough or sufficient enough for us to logistically manage the vaccine on-site without waste with a healthcare provider who has the qualifications to do that. So this week we're piloting with one of the faith-based partners in our community that's been a testing location for us to be able to see if we can make it work with some limited number of faith-based institutions who have the ability to have operations supported on site with a healthcare provider who has also been providing vaccinations in their clinical operations. So again, not compromising the safety and effectiveness of the vaccine. And these faith-based partners, their role is to be able to do outreach to their congregants and also to the neighboring community. So again, focusing on those priority populations where the burden of COVID-19 has been the highest. So these are not designed to be large, high throughput clinics, but should be able to have a minimum of 100 or so individuals there. Following along our model of high throughput for us is 800 to 100 people per day. Medium is about 400 to 500. Lower throughput is 100 to 200, and then we may have some instances where we do specialty on-site clinics.
And are you considering any like drive-through type sites or like larger venues like Nats Park?
So it's an excellent question. So you have to be mindful of how anyone will be using their property as the vaccine program rolls out. Our greatest limitation at this time is the amount of vaccine that we receive from the federal government. We have been pleased in the recent weeks that we've seen about a 15 to 20% increase in the amount of vaccine that's coming to the district now. And that's happened through a number of decision points that the Biden-Harris administration has made. How that is sustained over time, we look to see. We're optimistic that that will occur, and we won't see any reductions, only persistent increases. However, we vaccinate citywide through a number of access points, well over 2,000 people a day in the district when all of our sites are operational. And the current sites that we have with our health centers, our hospitals, and our pharmacies are not operating at full capacity. So opening up a high throughput site that could vaccinate 4,000, 5,000 people a day would just mean that we only vaccinate once or twice a day in the city. And we already receive emails that some of the practices that we have are not conducive to the person who works every day, who works 6 or 7 times a day, who would not be able to take off that one day a week that we would be vaccinating 5,000 people in the city, or essentially using all of our vaccine supply. So it's in fact more equitable to vaccinate, to put our vaccine supply out across the city at multiple sites. So at this point, as long as we're using up all the vaccine we get on a weekly basis, that's ideal in the goal, as opposed to opening up a single site and using all of the vaccine there. Plus, you have to think about how people would get there, if that would be fair and equitable from a transportation perspective. Now, once the supply opens, we're getting tens of thousands of doses on a weekly basis, it could make sense to do that.
And one more for you, Dr. Nesbitt, if I can. I'm wondering if, and this was referenced, I think, during a call with the council a few weeks ago, but I'm wondering if you've had any discussions with officials in Maryland or Virginia about receiving some of their doses, since we're vaccinating some of their residents who work here.
Yeah, so it wasn't a council call. I think there's been some emails from a council member on the topic, and that council member also raised it at the hearing. We have made a commitment with the state of Maryland and the state of Virginia, as the mayor has mentioned in her opening comments, that we will vaccinate essential workers in the jurisdiction in which they work, because it confers a benefit to us as a jurisdiction, because they're here serving and taking care of people in our respective jurisdictions, as well as the individual protection it confers to that individual who's being vaccinated. You will be reminded that both Virginia and Maryland did provide us vaccine when we were vaccinating healthcare workers. It was estimated that about 75% of the district's healthcare workforce resides in those other states. What I will say is that we are all challenged with having an adequate supply of vaccine to meet our respective workforce needs. In recent weeks, the Biden-Harris administration has hosted calls for us where, as the region, we're able to talk about our challenges and our needs to have more supply as a region. So we will continue to make those requests known. We will continue to talk about the challenges the district has, not only in having a doubling of our daytime population, which includes workers from Maryland and Virginia, and our commitment to wanting to vaccinate those essential workers, but also the challenge of needing to vaccinate a federal workforce that has been deemed essential. So all of those things are known. I communicate with the secretaries from both of those states about our desire to vaccinate their residents who work here and how complex that is and the challenges it may pose for us moving aggressively through our various phases. But to that end, and this is the last part I'll say about that, I think you all recognize that the state of Maryland will say that it's moving to phase 1C, and the counties in the National Capital Region don't advance to that phase either. So it is a problem for us in the district, but it's also a problem for the National Capital Region, and we all could use some relief.
Thank you.
Sam? Sam,
Mayor.
you got in late today. Wow.
I'd just like to ask Dr. Morris Hughes about the PUA. And you sent the checks for $1,200 because the program was ending. Did it actually end, or what is the status of it?
Yeah, so the program has ended. The $1,200 stimulus payment is a unique program created under the leadership of the mayor to offer additional assistance to DC residents who are also PUA claimants. We only ran the program for a certain period of time, and now the program has concluded.
So it's coming back up now, then, in fact, this month, or?
No, the $1,200 PUA stimulus payment was just for DC residents.
It was a local, this is not listed on this slide that's before us now.
Okay, so the PUA program is ended at this point?
No, the special stimulus payment.
Yes, the special stimulus payment has ended. The PUA federal program is still ongoing.
Okay, and so it was still ongoing through this gap of time here, or?
Yes, so through the CARES Assistance Act, it was authorized for additional weeks. I believe we're up to 50 weeks now for the federally reimbursed PUA program. Okay. So the program is still happening as we speak.
Okay, it never ended?
No, it did not.
Okay, because that was what the stimulus was about, was the concern it was going to end, right?
Yeah, that's correct. But Congress took action, and the president signed the legislation on December 27th, therefore continuing and extending the PUA program.
So it was kind of if you will, a bonus for the district participants.
I mean, it's certainly some assistance for those who qualify and participate in the program. We believe that the weekly benefit does provide some economic relief to those who are eligible to receive it.
Okay. And Mayor, just a couple of questions. First off, I understand you tweeted out something about the folks who, the MPD officers who were featured at the Super Bowl last night. What are your thoughts there?
Well, I think I'm glad that healthcare workers and first responders were honored, and our folks among them. So I'm glad that they were honored.
And I'm seeing that the Senate is considering $3,600 for all children. What are your thoughts on that?
I need to find out more, Sam, but certainly I listened to some commentary this morning about what it would do, especially from the House side. I'm not as familiar with what the Senate is proposing, but the aim is to lift children out of poverty. I think in a country as rich and great as ours, too many of our children live in poverty, and we've tried a lot of different programs that hasn't changed their trajectory. So if this one promises to do that, I want to learn a little bit more about it, and I am certainly for making sure families have what they need to give their children a better opportunity.
And finally, Mayor, are you convinced that D.C. will be let's say, treated as a state this time?
We continue. One thing I have learned is to follow every aspect of this debate to make sure that we are supporting what's in the president's plan, what's in the House plan, and at the end of the day, what the House and the Senate agree to. So President Biden has been supportive of making sure that we are treated fairly in this bill. Who hasn't had a chance? James?
Yes, I have a question for Dr. Morris Hughes and a quick one for Director Donaldson. Dr. Hughes, the program that you laid out in terms of the robocalls and the text and the AI is interesting, but you have residents in this city who are not still at the level of that type of technology. What would you suggest that they do in order to get in touch with DOES, because they're making phone calls through their landline and still can't get through?
So thank you for that question. You know, before I came in today, I had an opportunity, because I anticipated this question, to look at what our call volume is. And we've received over 800,000 calls since the beginning of the pandemic. Our call wait time as of Friday afternoon was about 45 minutes. The longest person that had to wait was just under 3 hours. So make no mistake, I understand the importance of being able to reach someone by phone, which is why the mayor and the city administrator have made some substantial investments in the UI program. So I think you heard me mention that I anticipate bringing on almost 200 additional resources. Some of those resources will be in the call center, so we can begin serving more people and serving them quickly. So it is not, I don't take it lightly, and that's why we're taking action immediately.
Quick follow-up on that. I understand we're in phase 2 here in the city in terms of the reopening process. Has there been any conversation in regards to maybe having a very limited presence at the DOES headquarters of people working there to help people?
So we are one of a handful of agencies that never close down. We have probably a couple hundred people actually in the agency now working. Most of them are on the unemployment insurance team. So we haven't closed. We even work on holidays. We also have the ability to have people come in and fill out a paper claim form and hand it to the front desk staff, or drop it off in a lockbox, which is available 24 hours a day. So we've been open, we remain open. We don't turn the lights off because we're always working, but I look forward to continuing to think about how we can have an expanded footprint when it is safe.
Director Donaldson, these programs in terms of rental assistance and what you just added in terms of small housing providers, are interesting. The problem is that many residents who are affected by your program don't know about your program. And I'm not asking you to be a PR person, but you have some situations where people have been evicted and they didn't know that they could not be evicted. My question is that how can they find out about these programs if they're not in the realm of the knowledge base?
Well, we've been centralizing our information via the coronavirus.dc.gov website. There's a special section there addressing rent and also addresses the legal protections that tenants have at this time because of the eviction moratorium, as Mayor Bowser spoke of earlier, and also because of other actions that both the council and the administration have taken. So we're working with a network of community-based housing organizations. They're all listed on that site and also on the DHCD site, and are also communicating with the community on that. And we will continue to do that through our public outreach efforts and continuing to communicate with neighborhoods and communities across the district.
Any other questions? Yes, sir.
Yes, I have a question for Dr. Nesbitt. The program, the pilot program of working through the church, do these churches require particular facilities in order to play this role in the program? Is there storage or anything like that? And can you walk me through just the philosophy or the idea of starting this program? What's the goal?
Sure. I'll start with the philosophy and I'll give you a high level on the facilities. So as you all may be aware, when we first started having conversations about the vaccine, before vaccines were approved, we were aware of the need to have very focused discussions and conversations in communities of color, and particularly African American communities, because of what we describe as vaccine confidence, or said the opposite way, vaccine hesitancy. And for many years, faith-based institutions or churches, places of worship, have had the ability to speak to communities of color, or African American communities, Black communities, and to be able to be leaders in those communities in terms of advancing a cause or getting people to understand why their health is important. The District of Columbia has worked effectively with its faith community on a number of critical health issues. If you think back to the 1980s, 1990s, the faith community in the District of Columbia was extremely instrumental in helping to educate Black people on the risk of HIV, how HIV prevention was very important and continues to be a part of that movement in the Department of Health. They are also very critically important to the work that the Department of Behavioral Health does around substance use disorder. So working very closely with us, we have members of the faith community that are part of our scientific advisory committee for our COVID-19 vaccine program. So engaging them and including them on our vaccine confidence effort was a natural fit or a natural progression. Part of what was proposed to us was that in terms of registering seniors, engaging congregations, and serving as a natural extension of their faith work, the communities in which they are embedded could help us reach residents, in particular in wards 5, 7, and 8, who have not gone to the websites, have not called the call center, not because of necessarily their inability to use technology, but because of maybe hearing that the process is difficult, or not necessarily having the ability to speak with someone about the concerns they may have about the vaccine, or having questions about the vaccine, or wanting to go through the process with a buddy or a friend that they go to church with, or someone that they feel a sense of connectedness to. And so we wanted to pilot this with a faith-based partner who has told us that they have members of their congregation or another congregation that is doing this in partnership with them at their location. So what does it take? Well, we're still social distancing, so you have to be able to register people safely in order to host on your site. And you have to be able to have a place where someone can be vaccinated with a level of privacy and dignity to some extent, right? Because this is, while it's a very low-risk procedure, some people do still want to have some level of privacy when they're being vaccinated by a healthcare professional. And then there's because of what had been identified as a risk for allergic reaction, individuals have to be observed for either 15 or 30 minutes after they receive the vaccine, and that needs to be done with some degree of social distancing. While they are waiting, we have implemented a process of receiving your appointment for your second dose. And there's, processes where people have the opportunity to receive some vaccine education and counseling if they have questions. So imagine the ability to have a logistics and a layout where you can register people, get the vaccine, and then have some counseling. Because of the storage and handling requirements for the vaccine has to be stored at cold temperatures. The one that we tend to put out in the community varies depending on who the provider is and what their home storage requirements are. It can only be thawed for several minutes before it is drawn up and the person is giving it. So those types of things also limit where these can be done in the community and the skill set of the provider. We typically recommend that an on-site clinic not be held if at least 100 people are going to be vaccinated on that given day. And then there's also some technology requirements on the behalf of the actual vaccinating provider. That does not have to be the church itself.
You're calling this a pilot. Is this something you're looking to expand?
If done successfully, if it draws the right community that we're trying to reach, we may expand.
Thank you.
Yes.
For you, Mayor Bowser, about the Public Service Commission. You nominated Lorna John late last year and then withdrew that nomination, I think, a few months later. I'm wondering if you could explain why the withdrawal?
I think Ms. John requested to be withdrawn.
And then you recently announced a new nominee, Emil Thompson, he'll be the third member if confirmed. Can you talk about Mr. Thompson's qualifications, why you think he deserves a seat on that board? As far as I can tell, much of his experience is in the criminal justice sector, although I'm aware he's served on the DC Water Board as well.
Well, I think you just answered your own question. Emil we're very familiar with Emil's work. He worked in DC government for some time. And I appointed him, I guess it's been a couple of years, as our representative on the DC Water Board, which is a very important utility for all of us, obviously. And I think in being on a governing body of a utility is direct experience in working as a commissioner to ensure that utilities provide safe and reliable and affordable services.
Did he apply for that position, or did you seek him out?
I believe he applied, but I
And-
do both, as you can imagine, when I am filling positions. At the Public Service Commission, I'm pretty sure was posted, and I believe he applied.
And I've been speaking with some folks in the energy solar sector who are a little upset, I guess, that their choices didn't get nominated. I'm wondering if you've had any discussions with folks in that area and if you've considered someone with some solar energy experience for that board.
I've considered people, I've nominated a number of people for that board, and I've considered all manner of experiences. And I've been involved in that board from my early days as serving on a council member, and I haven't experienced a nomination that didn't have somebody not upset with the nominee. So as I do with everything, I look at a person's experiences, what their vision is, and their ability to do the job and represent the district well. And I'm very confident in Emil's ability to do that.
Thank you. A few questions for Dr. Morris Hughes, if that's all right. I think there was the unemployment system went through an update, I believe, that was supposed to be resolved, I think, last Thursday. I'm wondering if that actually was resolved and if you know how many folks were impacted by the pause, I guess, or what, could you explain what the impact was?
Sure. So we are always going through updates. Actually, every evening at 7 o'clock, we take a look at the system and make system updates. As part of the Continued Assistance Act, we are making a series of updates to extend the number of weeks for PEUC and for the EB programs. And in that process, we needed to do some additional coding. So there were some claimants that were impacted by that, and then claimants that were impacted by it received an email asking them to certify to receive their weekly benefit payment. We are estimating somewhere between 2,000 to maybe 4,000 individuals that were impacted by this system update. We have implemented the fix and deployed this certification, and so folks should have received what they needed to certify. When I checked this morning, I believe we had nearly 3,000 people who had completed all of their certification forms and are prepared to be paid the payment that will go out tonight.
Thank you. And this could be a question for you, Director, or perhaps for you, Mayor Bowser. I think some states are starting to waive taxes on unemployment benefits. I'm wondering if either of you would be supportive of that. I think DC taxes its unemployment benefits.
So at this time, I don't have a recommendation on what we should do. We've been laserly focused on trying to implement all of the federally required changes. It's something that I'll have our tax and our council look at. And when I feel comfortable that we have a strong recommendation, I'll bring it to leadership. But at this point, I don't have anything additional to add there.
Do you have any thoughts, Mayor Bowser?
I don't. Yes, thanks.
Sarah Payne with the Hill Rag.
I can't hear you.
Sarah Payne with the Hill Rag. Is DC Health using or planning to use robocalls to reach households in Wards 7 and 8 with info about vaccine registration or eligibility?
We use many different ways. We've done a direct mail. I'm sure we've done some robocalling as well. So yes.
And then is the DC Healthcare Alliance going to be part of the effort to get out information about vaccine eligibility?
I'm not sure what that is.
What is the DC? Which alliance are you talking about?
The DC Healthcare Alliance?
DC Healthcare Alliance.
I'm not
Is
sure
that
what
the
you're referring to.
Alliance of Hospitals?
And
Tell me more. Which group is that?
just the DC Healthcare Alliance?
Okay,
I'm not
can I
sure.
get back to you on that one?
Yeah.
Okay. Yes, Sam, last question.
Yes, Dr. Nesbitt, just a question. The vaccine, how long does it last? I mean, you get a vaccine today, you have to...
Nobody knows, Sam. Nobody knows.
So I was just saying, is it like a flu shot? You're supposed to get one every year?
That's the legit answer. Nobody knows. That's one of the things that's still under study by the manufacturers of the vaccine and the scientists. Is that, and that's the reason why this participation in the clinical trials still goes on after the vaccine is approved and authorized, is to better understand how long immunity that is conferred from the vaccine lasts. So we want to be able to understand if this is a vaccine that you will get once, and it confers you lifelong protection. If this is a vaccine that you may have to get once a year, similar to your annual influenza vaccine, those questions still need to be answered. So when I say nobody knows, that is still one of the pending questions from the clinical research trials.
Teacher who passed away from COVID at Ballou State, do we have any details on that?
I don't. The Chancellor Farabee advised me, and I won't make any specifics because I'm not sure if the health officials have been able to get involved. But we understand a teacher who had been in the school on January 11th notified us that she had COVID, and that's really all I can say about it.
Do we know if she was in contact with anyone else or if anyone she was in contact with tested?
As I said, that's all that I can say about it. We don't know her residence. We don't know yet about contact tracing or more than that.
Thank you, guys.
Thank you.